Welcome to OpenTalks. So today's discussion is about cancer screening. The word screening should be correctly interpreted. Screening is different from prevention. Prevention is taking steps for not having a certain disease or a health condition. But screening is something like you have that disease in you, but you are not aware of that and you are trying to diagnose or detect it in an early stage. So that concept is called screening. Screening became a big impact, especially in the field of oncology. There are screening for diabetes, hypertension and all in the population. But cancer being a deadly disease or a fearful disease, screening had a big impact. There are many mandatory things to be followed before adopting a guidelines for screening. The mandatory thing is it should be reproducible, it should be easily doable, not that time consuming, labor consuming and even cost consuming. And the false negative and false positive rate of that procedure should be weighed and it should be easily reproducible in a population. So the attempt of screening has been done for many cancers, but as of now, there are 3-4 cancers only which screening had made an impact. The most common things which screening is recommended is basically breast cancer. Then second is cervical cancer or uterine mouth cancer. Third is oral cavity cancers. And fourth most recommended screening is now the new in the list is lung cancer. There has been screening for prostate cancer, especially in Western countries, they do prostate cancer screening routinely. In India, we don't routinely recommend prostate cancer, at least in a population base. Screening can be done either through a population based or through something called opportunistic screening. Population is something like you go to a town, you go to a village and screen all the people whether they have cancer. But it requires more of time, labor as well as cost consuming. And many of the times it may not be fruitful result. So I normally push more for opportunistic screening where you reach for some other issue to a hospital or a doctor and the doctor take time and understand you. So that, for example, you come for a back pain and the doctor tells you that you're 50 years and old, so you have to go and get a mammogram. So that's called opportunistic screening, which you should focus more. If you take breast cancer per se, the screening detects an early breast lump and you can plan the cancer treatment accordingly. Cervical cancers, other than the pap smear, there's something called pap smear technique where an MBBS or a gynecology doctor can take a smear. There is something called HPV DNA or human papilloma virus DNA which can be done from the blood and you can estimate the risk of cervical cancer. Oral cavity cancers are mainly visual inspection, and the last which has come to the list is lung cancer because lung cancer is overtaking all other cancers and becoming number one, and majority of lung cancer is still diagnosed at advanced stage. So newer studies has shown that if you have more than 20 pack years and you are more than 50 years, so then once you have to undergo low dose CT scan. It's not X-ray, it's low dose CT scan. The duration is 2 years to 5 years in interval, but it has shown to detect the lung cancer at early stages and by that to cure the cancer. So many of the times all the methods are not reproducible in India, especially if you take lung cancer, the patients are not getting dates for CT scans, so you can't ask screening CT scans. But still, the self-breast examinations, mammogram, pap smears, all these things can be readily done. And I think so screening has saved lives, so you should not run away from screening. Thank you.